Good morning, humanity. It is April 25th, 2022, and it's our favorite time of the week because it's Mondays with Bev and Paul and Eileen.
Eileen.
Good morning.
All right. Good morning, Bev.
Good morning, Paul. Good morning, Eileen.
Good morning, everybody.
All right, so we have a special, always we do the Monday before our workshop. We try to bring on the person who's doing the presentation. And so Eileen Webster is our presenter, and we use Mondays to find out a little bit about them, not necessarily what they're going to present about the topic, which is be pain on Thursday. So Bev and I are going to drill Eileen here for a little while and find out who she is. Who are you?
Who are you?
You just spent a whole weekend finding that out. So tell us,
Right.
who are you?
Or who you're not.
I am you. You are me.
Oh, praise the Lord. There you go.
There it is.
All right. So tell us a little about your, why are we bringing you on to talk about pain? First of all, what's your professional history and how you even got involved in that?
Right. So I'm actually a pharmacist. I had a drugstore back in Colorado for almost 20 years, a little independent pharmacy in a rural mountain town called Fairplay. And, but in 2019, I moved from Colorado, or excuse me, in 2017, I moved from Colorado down to Marana, Arizona, which is just northwest of Tucson. And I was in a local cannabis dispensary, right? And I was observing the interactions between the, what we call the bud tenders. Those are the young people that work the counters there, the technicians, right? I was observing the interactions between these technicians and the novice medical patients, right? Well, mostly because it was a busy day and I was waiting my turn to get my pain medication. And I was just watching these and it was interesting that what I was seeing like little to no information being handed out to these patients. They'd ask them, would you like a packet? And they're a packet of what? I don't know, no, whatever. They didn't even know what they were being asked. So there was little information being given to them about what this medicine is, how to properly use it, what kind of drug interactions there are, therapeutic interactions, side effects, all this crazy stuff, right? Or, oh God, am I going to get a bad trip from this or something? And so there's nothing available to these people in these dispensaries. But what they do have is there's a picture on the wall of the medical director. And they always look real sharp, nice smile, and there's their name and that they're the medical director. And they're supposed to be available somehow for the patients to ask questions, but they're not on site. They have another business, right? They're seeing patients otherwise in their regular business. And there's no phone number right there for you to dial them up and call and say, hey, I've got Parkinson's and I'm on these 4 medications. And I was told, because I can't sleep, to try cannabis and I don't know what to do. What should I do? Right. And so there's nothing available to these people. And these bud tenders, God bless them for at least being there. They're great technicians as far as when it comes to what products are available in that dispensary. Does it come in cherry flavor and grape flavor? Is it a 2-for-1 special today? Or if I wait till next week, or this company doesn't have a good reputation, their products usually break, or, so they're great. They're great technicians, just like in a pharmacy. My technicians were awesome. I couldn't operate without them, right? They were my hands as far as getting all this extra work done. But they needed the pharmacist brain in the drugstore to be able to answer those questions, right? What people were used to doing, when you'd see a commercial, the person's dancing through the field with this new medication, go ask your doctor or pharmacist about it. So I had to be available, right? And that's what your pharmacist is used to doing. And so really, who do you know out there in the world that knows more about these biochemical processes in the body, right? About the drugs and the receptors and interactions and duplications and all of this kind of stuff, who is readily available. And that's your pharmacist, right? So I believe there should be a pharmacist in every medical cannabis dispensary. Medical, okay, recreational, that's a whole nother game. That's
Right.
not what we're talking about. This is medical cannabis. And the reason for this too is this is a serious medication when you're using it medically, right? Because cannabis is actually, the effects of it can be biphasic. So we can actually cause the symptoms we're trying to treat or relieve, right? So if you're going through chemotherapy and the nausea is out of control, and we select the right strain for, you just randomly go in, right? And you try to select a good strain. Well, that could be one that's known more for being more stimulating or making you sleepy, or this one's better for inflammation, that you really need one that's, you know, working more heavy on your nausea. So you need help that way. But then if you don't know how much to use, you try a little bit and you're like, oh, I still feel sick. And you try a little bit more and a little bit more. And then, okay, I feel better. Oh, but now I'm sick again. You don't realize that you've just thrown yourself over the line from that therapeutic window that we want you in, back into now causing these problems again. And so, plus there's also no established doses, right? It's not like Tylenol where there's, you know, junior strength, regular strength, extra strength, or anything like that, or children's and adult Robitussin or anything like that. It all depends upon where your endocannabinoid system is at. So, you know, if you're too far this way, too far that way, you know, everybody's endocannabinoid tone is a little bit different. So the dose is going to depend upon where you are. Where do we need to bring you back into balance? And also how sensitive you are. If I give you a little dose, are you just going to go this far? Or are you one who a little dose is going to send you this far? So that's why one size doesn't fit all in these dispensaries. That's why you need a pharmacist to be guiding you through product selection, through how to properly dose, through, you know, just through the whole process, right? And so that's my goal, is to get somehow a pharmacist into these dispensaries.
So how did, let's go back a little bit here. So how did you even get into, like, what brought you to even get into cannabis? What's your personal story of wanting to work in this? Why did you even leave Colorado to come down to Tucson?
Right. So life was grand until a genetic connective tissue disorder that I have called Ehlers-Danlos syndrome reared its ugly head. And it started off with, you know, just multiple joint dislocations. You know, all I had to do was aggressively point across the pharmacy. No, it's aisle 3. And oh my gosh, I would pop a shoulder out or a rib out or my neck or something. It was just simple injuries like that that wouldn't heal. And again, since it affects all the connective tissue within my body, you could imagine this affects the muscles, the tendons, the ligaments, the fascia, everything hurts. So that's one of the most common symptoms, of course, with Ehlers-Danlos syndrome, is the chronic, unrelenting, or just, there's no relief, it seems like, to this pain. And so, of course, as a pharmacist, I've got all these, you know, resources at my fingertips. I've got the ibuprofen, I had the Tylenol, I had herbs, I had vitamins, everything in this store, and I was trying everything, nothing was working. So of course I go to my doctor, help, I don't know what else to do. So what do they give you? But here's a pain pill, it's okay. Like, well, no, I don't think these are okay, because I learned in school this, and they're like, oh, but you know what we were taught in school, I guess, is wrong. They've come out with new studies now that show you can't get addicted if you're in chronic pain, that you know your dose better than the doctor knows it, and so you should be in control and just take as much as you need. I'm like, these studies make no sense. Who's doing these studies? Well, the drug manufacturers, of course. So I didn't agree with this, but I didn't know what else to do. So I took my first pill and it helped. So then I took the second one when the first one wore off. And then when the second one wore off, I took the third, and and here you go. You're a couple years into this, and your pain is now dependent upon these medications. Plus your emotions are all over the place, and life just kind of spirals out of control, right? And so that's it. I decided no more of these. So I literally locked myself up in the house for a couple of months, took my last pill, flushed the rest, and decided I'm going to figure out how to handle this pain otherwise. But the withdrawal was terrible. And I didn't know what else to do to treat the withdrawal, but use cannabis. I used it for the nausea. I used it for the, being able to sleep, for the muscle spasms, and for some of the pain. And then I noticed, wow, this is actually working better for the pain than any of the other remedies I had tried in the past. There's something going on here. But we moved to Arizona just to get out of the altitude and to closer to family and more medical resources than that crazy little town we were in. And so when I got down here, I decided, again, there is no way I'm ever taking one of these pills again. But my pain started coming back down here due to other factors. And those other factors I found out were actually because of food allergies to the fresh foods that I now had available to me here. But anyway, so my pain started getting bad again. And I ended up back in the dispensaries looking for solutions. And it was when I saw all this going on that I decided I'm on this mission, right? So, but this is not something they teach you in medical school. So I went on a mission, self-educating, finding every program I could find out there until I became Arizona's first certified clinical cannabis pharmacist.
Right on.
And so
That's awesome.
my mission is to just help people with pain, with chronic pain, either reduce their opioid dose, get off that dose, or just prevent them at all just by, using cannabis and other, modalities, but cannabis at least to get that pain and these other symptoms under control so that you can move forward with your life and start doing these other things you need to do to get yourself out of chronic pain.
Wow, that makes so much sense. What you were saying about that, the partnership between, because this whole medical cannabis, CBD, this is a new area for everyone. And it's starting to become, more prominent, and states are adopting it and everything. So it makes sense that, you don't want to just go out there and arbitrarily just start experimenting with stuff. Right. So it makes sense that you have a group of people like you who have some knowledge that can integrate into this new, really medical, healing type of community that's popping up everywhere. So that's just awesome, Eileen. Congratulations. I did not know that we had someone so amazing in our foundation.
Right. So,
yay.
Eileen is going to present more about pain and things that you can do for it. And we do know that Eileen is also part of the BioTouch family. I mean, so
it is.
So you find that things like BioTouch work with the cannabis programs too?
Oh my gosh, I think I've stumbled upon one of the best things you can do to combine with cannabis for pain as BioTouch. I'm sorry, but a pain patient, you learn to disconnect from your body. You start to disconnect and almost you want to escape it because it hurts so bad to be in your body. Yeah. And BioTouch is a way that you can gently reconnect with your body, and also begin to unwind this whole crazy process that has developed, this tightly wound spring that has become chronic pain can now start to unwind, and you can pull it out and look at all that's going on.
That's beautiful. I love that.
So it's interesting. We might just keep you on here because the title of this show was Grateful for Biotouch. And so Bev and I were talking, and maybe the three of us, so we'll let Bev take over here for a little while too. We'll keep you on, Eileen, and we can all build on
you know,
this.
I gotta say,
for with it?
I gotta say, only because we know Eileen's history. We've kind of been on that journey with her since she came and found BioTouch. But I know personally that how grateful she is that she found BioTouch, because what I've noticed is she's gone into these other areas through that. We always talk about that self-awareness that BioTouch brings to us. And we remember Eileen when she first found BioTouch, and we can see, and she's always talked about how grateful she is because of the awareness that BioTouch has helped her to unravel and unwind and be able to participate in her own body and in that journey consciously. I mean, you know, for me, I have always, it's almost like the new affluency that Paul and I have talked about before that BioTouch can bring, is that it actually allows us and opens us up to being grateful. When you're in pain and suffering and so dark that your body, you want to escape your body, you cannot, what are you grateful for? You can't pierce through that fog, right? So again, BioTouch on so many different experiences within our own lives allows us, you know, not just physically, but everything opens up, and that in that self-awareness, you realize that gratefulness that you can identify with, that you can acknowledge now.
Yeah. So Eileen, you and I, we went to this conference this weekend, right? And a lot of gratefulness for BioTouch, I know for me, came up, you know, that it's easy, that there's no levels, you know, that one part of it is I'm grateful that it's like this ancient, you know, I've heard numerous times, it's ancient shamanic healing, it's ancient Egyptian healing. Well, it's an ancient healing technique that is being reawakened in humanity today. We've all brought this healing technique, and what's nice about BioTouch is it's a gift everybody brought, and now we just need to all share it. You know, it's you know, you see people know it already, and so the gratefulness of having the ability to share it freely with people. So
yeah, I'm very grateful all the time that I am part of this. We call it a revolution, but we're ancient. So we already carry, and we've said this many times, we carry a lot of ancient DNA, memories in our cells and everything. One of the things that we carry within is remembering that we all here to do BioTouch. It doesn't always have to be trauma that's locked in ourselves. We also are given an amazing gift that's already locked in ourselves to help us go to this next evolutionary step, this awareness that we call consciousness.
So how about you, Eileen? What's grateful to you about BioTouch?
You know, when you are in pain, be it, you know, acute, but especially chronic pain, there becomes little that you are grateful for, because everything hurts. Your clothing hurts. Even the one place where you're supposed to be safe and comfortable in your own bed, your bed hurts.
Yeah.
Sleeping hurts. So instead of becoming grateful, you become fearful. Fearful of everything, everybody, all the doctors, and even folks that can help you, because you've been hurt so many times, not just physically, but emotionally by the medical system, right? that I'm so grateful that here is something I don't have to pay for. Here is something, you know, when I'm already broke because I can't work. Here's something that I'm grateful that I can just, the next to me in bed can help me with, and I can help them. I'm grateful that it is so simple that there's no crazy guru that you have to chase halfway across the country and wait 6 months for them to get up on stage and hope that you get the vibe from them that heals you. You know, I'm grateful that there's no fear involved in it, where there, you know, if you don't do it right, some negative entity is going to jump onto you, and instead of healing, you're now going to get sicker. You know, I'm just, how much time do you have?
We're actually out of time. We just did 20 minutes, ladies.
And we just started.
So, you know, join us every Monday. We'll bring Eileen on so more of these fun things. But tune in Thursday evening, 6 p.m. Tucson time. You can live stream it. We also post it, and Eileen will send out another post with the YouTube link if you're a YouTube watcher. But join us. Eileen will present probably, I'm sure, a very detailed explanation of pain, how we get it, how we can help ourselves, all the different ways to do it. Go to her website, just launched, Medicate-Ed, medicated.com.
I love it. I love it.
We appreciate you, Eileen.
Oh, yeah.
Thank you, Bev.
I appreciate you guys.
All right. We'll see everybody Thursday evening, and if not, next Monday. Bye, all.
Bye.
If pain has got you down and you live in town, take a trip down to Pima Street. The people down there are people who care. They will get you back on your feet. Put love into action. Put love into action. If you ever want to have any real satisfaction, choose love while you still can. Don't even try to understand. A healing grace in your own hands. Put love into action.